Hello, everyone. We're going to go ahead and give everyone a couple minutes to log on, and then we'll go ahead and get started. Okay, we're going to go ahead and get started. Good afternoon, everybody, and welcome to this month's Schools Health Service Multidisciplinary Information Session. I am Mary Cruz Lopez, Community Engagement Specialist with Nevada Health Authority. Today's session focuses on understanding roles and services. We will explore collaborative roles in school-based Medicaid, clarify how these roles work together within a multi-tiered system of supports, and highlight why collaboration is essential for meeting students' needs and sustaining school-based Medicaid programs. Before we begin, just a few quick notes. Today's session is being recorded and will be posted on our website at schoolhealth.nv.gov under the trainings page. We'll have time for questions at the end, so please feel free to either raise your hand or add your questions to the chat box as we go along. And I will go ahead and hand it off to Monica to start.
Hello and welcome everyone. So nice to see everybody and have you here today. Actually, it's a very big privilege to be here with you today. So I'm going to go ahead and begin. Once again, welcome. Today we are discussing the critical framework of collaborative roles in school health services. Our focus is on how to identify, define, and support our specialized instructional support personnel. We're going to use the word SIPs. How we can transform our educational environments by integrating academic, behavioral, and physical health services. We can build on a cohesive system that better supports our students, families, and the broader community. So the question is, what are specialized instructional support personnel, SIPs? As defined in NRS 388.890, we provide key services like assessment, counseling, and student support. In Nevada, SIPs help drive school safety, positive climate, and student health integrated services, strengthen outcomes, reduce duplication, and rely on strong leadership and staff commitment. Today we're going to talk about our collaborative roles. This document has been inspired and worked through by Nevada Health Authority, Nevada Department of Ed, as well as the Nevada Reno University of Nevada at Reno. Collaboration of many stakeholders here at O'Surley and others in the community who have updated the collaborative roles document. It's including expanded services like nursing, behavioral health, working together to create a safe, supportive school environment. Research shows that integrating social, emotional, behavioral supports improves attendance, improves behavior, academic outcomes. And here at the Nevada Department of Education, it promotes multi-tiered system of supports to ensure equitable, integrated academic, behavioral, mental health supports for our students. As we work together, we have a statewide school health services team, and this is our mission. Is just recently here created by our team. I'm going to read that to you, although I know you can see it, but it's really important work. So behind the scenes to align education and healthcare systems and provide clear, consistent guidance for our districts in the state of Nevada, our shared goal is to help school deliver high quality supports that complement the care students receive in their communities and support their overall well-being. Here I am providing you with a slide that shows our tiers 1, 2, and 3. I've highlighted here foundational elements, which I think throughout the nation we are having to integrate family, school, community partnerships, and professional development and support for a healthy school workforce due to the high needs across the nation. Some of the presentation will talk about the lack of funding in some of our areas. So it's really integral to also include community supports. Now, as we discuss MTSS, we're looking at the entire school health system and helping the academic side of our students' learning. So from moving from crisis response to sustainable collaborative multi-tiered systems, youth mental health challenges are a sustained structural shift, not a temporary spike. So SAMHSA has done many years of research, and one of the main elements we'll also discuss is chronic absenteeism. And in looking at the 3 rings of school, family, community, as well as the strengths of our SIPs in our schools, and how we can collaborate together to help our students achieve higher academic outcomes. So here, our very important SIPs are showing some of our staff, beginning with our school nurses and how they conduct assessments for every child, whether it be vision, hearing. Here in Nevada, we have some NRSs that scoliosis, tuberculosis. We've got lots of screening. So our nurses are a huge, huge integral part and proponent of catching and seeing exactly if there are any underlying medical issues with our students. Then on to our counselors, very vital as well to our academic trajectory for our students. Social workers, both school social workers as well as clinical. And lastly, of course, our specialized positions, as I will get deeper into the individuals. A lot of our support staff provide data-driven programs that guide all our students towards academic, social, emotional success. And school nurses bridge the gap between healthcare and education, managing both chronic and acute health needs to keep students in the classroom. Our school psychologists consult on learning barriers, provide behavioral interventions, and are vital in evaluating special education needs. Importantly, all these professionals serve as active members of our MTSS teams. One of the factors that are affecting across the nation is early absenteeism. If we look at this example, the catalyst of chronic absentees affecting kinder to first grade, missing between 15 plus days. Obviously, it creates an academic impact up to 4 times in the future of our learning for those students are more likely to drop out of high school. Then it escalates to 7 times higher risk of dropping out. And as one factor, early absenteeism could cause lifetime cost for a 9-year reduction in average life expectancy. I'm getting this info from Crisis to Action. I will share the link when the presentation is over, but it goes back to one of the factors that has been provided by years of research of SAMHSA and the ability to provide strategies and support for students with issues in early absenteeism as one of the factors. Here is a visual explaining our providers in providing Tier 1, 2, and 3 services. And SIPs are vital to providing these services as well and necessary. This slide, historically, Tier 2 has been the missing middle across the nation, forcing our schools to over-rely on crisis-driven Tier 3 referrals. So again, our SIPs teams are extremely important in identifying and supporting our students throughout their academic lifespan. Now, going to go back one. Basically, protecting our SIPS boundaries. This is something we all know, and I think we can all agree. It can be difficult as you work in a fast-paced school environment. Here, giving you kudos and providing you support is really important too. Understand that when schools are lacking in resources or staffing, sometimes some of our SIPs can be asked to cover classes, supervise in other areas, assist with general principal office duties, perform disciplinary actions, or assigning consequence for discipline when we have other staff that could possibly do it. Acting as primary critical or data entry staff, acting as sole case managers for IEPs. It would be ideal in a wonderful world if we had plenty of money and lots of resources so we could optimize our top of license specialized scope of practice, tiered MTSS interventions and data collection, Medicaid billing, health and wellness services. We're hoping to change the trajectory and able to make sure that we use our amazing, talented SIPs and know that we understand and know that it can be difficult while you are in the schools. Here is a table just projecting or explaining the ideal ratio in some of our schools across the nation. And most importantly, knowing that our school counselors often focus on academic SEL master scheduling. Our school social workers are looking at homeschool community links. Because of our changing times, our school counselors and others hopefully soon will provide universal screening transitions, also including alternative, I'm looking at the key deliverables, alternative ed and wrapping around care. And so our licensed specialists are supported by highly trained classified staff professionals as well, who extend the reach of our care. Our community health workers, those of you that have access to them, are forged partners to bring outside resources directly into the school. I've learned so much here in Nevada that the opportunity to have those community health workers are just huge. It's something that we need, and hopefully we can either find the staffing that we need and or use our other professionals that are available, like a community health worker, to help maintain some of the calm that's needed. Some of our community health workers could help provide behavior plans under the strict supervision of licensed clinicians. Personal care assistants and LPNs provide essential daily living and medical support for our most vulnerable students. And together they ensure that care plans are executed consistently. Here's an example of if we took that huge ecosystem into action. If we had Marcus and he missed 5 days of school and disrupt class, the teacher logs data and flags the MTSS team. Within using our universal screening, soon to come, I hope, to Nevada, the school counselor reviews Marcus's file, conducts a brief check-in, and identifies behavioral barriers beyond standard academic struggles. by the universal screening and referral process, the behavior specialist observes Marcus, creates a Tier 2 specific data collection system, and coaches the teacher on positive behavior supports. And so that begins part of the identification, and then on lastly to the clinical escalation, which can then hopefully provide a skilled licensed professional. Lastly, I did want to talk about the opportunities that are available. Our Nevada Health Authority has acquired funding. We will share in the chat the link to look into the Rural Health Transformation Grant. These funds are available for schools, districts to be able to apply. Nevada Department of Ed will also be applying, attempting to provide if all goes well and we're granted some school-based mental health positions to help some of our rurals. As you all know, I did want to share, due to expiring federal relief funds, it creates impending fiscal cliffs. So because Rural Health Authority has acquired funding, I'm hoping that many districts do take the opportunity, and we're here to provide support. But unprecedented federal investments, some of our grants are very close to ending here in September. And so this hopefully will help shift from grant funded silos eventually to be able to sustain these positions within our current Nevada structure. Upon all grants ending, we're hoping that schools can pick up these positions. Action agenda, basically building a sustainable school health system. We want to applaud UNR. They are our support system to provide MTSS trainings. So within your school and your district, as leaders in your schools, we hope to be able to be there for you to build the architecture of what we're discussing today as the collaborative roles, not sitting in silos, but asking each other how we can help one student go from the nurse to the school social worker, counselor, on forward to our other licensed professionals so that we can help each student one by one. And as you know, in implementing Medicare, we can, Medicaid is eligible to Tier 1, 2, and 3. So again, please reach out to us so that we could help get that structure built within your school and in your district. And that was it for my presentation. There's a fun infographic I'd like to share, but we're open for questions. I do have some wonderful people here with us that are from OSERLI, as well as Nevada Health Authority, as well as Nevada Department of Ed and UNR. So if you have any questions, please go ahead. And I do want to thank the group. I see many of your faces and names that put together the collaborative book together. And we have Nancy, of course, with Nisha, and we got Dr. Pam and Monica Schiffer. We've got lots here. Did I spark any thoughts, ideas for anybody? Dana's here. Miss Bree Taylor's here. Oh, go ahead.
Hi, my name is Wayua. I'm School Health Services Program Manager with Anthem Medicaid. And I did actually have a thought about your presentation. I can't remember what system you called it, but it essentially would flag a student for absences. Am I understanding that correctly? And the school social worker would be notified?
Mm,
Yeah. Okay. So I had a question. Is it possible to somehow, depending on the student's need, so maybe the student is chronically absent from school because their parents need like childcare and they have to go to work. Is that something you can then tag in an MCO in order to attempt to address that need? Does that make sense?
Um, so absolutely. Um, I think I want you to ask me the question a different way because I want to make sure I'm
Okay, no
understanding.
worries.
Mm,
So for an example, with Nevada Medicaid, I'm pretty sure all, if not most, of the 5 different MCOs have a housing program, a part of their social drivers. So it's something that we're required to do. Anthem was the first to do it before it was a requirement. So speaking about Anthem specifically, if I came across a student who is facing homelessness, and they're an Anthem member, that is something that Anthem can help the student and their family with. So if a student is facing homelessness, and I know you have Title I, so maybe that's not the best example. So let's say the parent is using the child as childcare for the younger siblings. So we could potentially step in and help with alleviate that burden with childcare. Does that make sense?
okay,
So
I get
stuff
that
like
part.
that, things that, yeah, that maybe the school wouldn't be equipped to handle, but they can tag in the MCO if they're a member and say, hey, we have this student, they're experiencing this. And although we can't assist, we know that you guys have programming that may be able to assist the student and their family.
Well, thankfully we
Hi.
have Dr. Pam here.
I know, I was just like so itchy. I was like, ooh, you said homelessness. Thank you for posing that question in a different way. And I do want to thank Monica and the rest of the group for this beautiful um, gathering today. And I'm really glad that we can have this conversation. I am Dr. Pam Janelle. I am the McKinney-Vento State Coordinator for the Nevada Department of Education, and I oversee Title VII-B funding, and I also consult on the Title I-A homeless set-aside that the Titles Group work to address and alleviate homelessness in schools. The upside to your question is that we do actually have some resources in place, but with regards to the scenario that you presented, each district does have a designated McKinney-Vento liaison who literally, when a student is enrolled in school and let's say the parents say, hey, we're experiencing homelessness or we may be about to experience homelessness, they're able to immediately start connecting the family to different resources. This also includes early referral to, let's say, Head Start, Early Head Start, and other
Mhm.
early childhood programs for younger children in the event that they do need childcare. So the student isn't having to stay home and be a caretaker for their younger sibling while the parents try
Right.
to go to work. Um, the Nevada Department of Ed has developed some resources such as the Nevada Compass app, and we're finishing the final edits on the Navigator website that literally came out of my office. So as you can see the visual behind my head, I don't know
Yes.
how to point the wrong way. But what I can do is I could actually put those links right here directly in the chat. The Nevada Compass app literally connects families directly to school district personnel where they could actually fan out all of these different resources and supports, which does include the MCOs and other service providers. And it's in real time where most of the time I would get calls to my office and then I'd have to be like, hey, what city are you in or whatever. Now this app literally takes that from 30 minutes to 3 days down to like a matter of seconds. I hope I answered your question, but if you have another one, go ahead and pose it
Yes,
and we can go from
that was
there.
just kind of like a question, the best scenario, I guess, I could come up with on the top of my head. But I'm thinking in general, because I know Erica mentioned about insurance and billing being processed on the back end, but that's not something that would necessarily be billable. So even if you had a student who was involved with the justice system or their parents were involved with the justice system and they needed some assistance, that is something that the MCOs can assist with. And I know that this is all very new to both the school systems and the MCO. So we're still trying to navigate it and get the word out. But I'm wondering if that's something that um, we can kind of think about as we're putting these new things into place so we can better coordinate and I guess just reach more students, because it's not something that has to be billed. It's a additional service that we provide to our Medicaid members. And every MCO looks different. So if you have a situation where a student or their family is facing housingness and maybe Nevada Compass and Title I can't assist, that's something that you would go to the individual MCO and they could talk offline. So if anybody has that kind of question, I'm happy to talk offline about it more if you have any Anthem members. But it's just, I'm just kind of thinking long term, as it seems like this is something that's going to continue the partnership with MCOs and the school systems, how we can better integrate and assist so that way there's not all this burden and depending on funding on just one source, if that makes sense.
And if the MCOs would be willing, I'll put my email in the chat if you want to link up with me, and that way I can also get you connected through the app and the website as well. So that way that can
Yes.
increase that and engage families more. Thank you.
You're
I
welcome.
see some hands up. Sharon.
Yeah, hi, thank
Hi,
you.
Sharon.
So, hi, Monica, good to see your face. So to piggyback kind of on what Erica was saying is that we don't ask, as in general, what insurance folks have. We do not
Right.
ask if people are Medicaid eligible or not. We provide services and support to all students. So if you're only as the MCO, if that's the right acronym, if you as the MCO are only supporting your members, we don't know who is your member and who is not. So we would, if the only way we would be able to support that is to refer everybody to you, and you would tell them whether they're a member or not. We don't ask that information. We don't get into the insurance questions